Hi everybody, I'm Gail from Yoga Be Me, and today I'd like to talk about child's pose, or Balasana as it's known in Sanskrit. Balasana or child's pose is a really great pose for cooling down, for relaxing. If you've done a little bit of hard work in yoga, or if you've been feeling a little tense that day, going into child's pose and really absorbing yourself into it is a great way to relax. Balasana is not the pose for you if you have a knee injury or replacement. If you have any problems with your ankles, perhaps it's best avoided. You shouldn't do this pose in the third trimester of your pregnancy. All expectant mums out there, take note of that. And if your blood pressure is very low, not just a little bit, but if it's very low, then this probably is a pose best to be avoided. But if you have none of these issues in your life, then Balasana or child's pose is a great pose for you. Normally, child's pose is a pose that is practiced in the middle of yoga practice. Sometimes if teachers have been noticing that students have been working a bit hard and they need a little rest, a little come down before they go into the next flow or into the next pose, they will often instruct the students to come down into Balasana or child's pose just so that they can put their attention inwards, to gather themselves again, to allow their breath to come back to a normal and more relaxed range so that they're ready to go on to the next set of poses. But it can be used in life by anybody. It can be used in life even by people who aren't practicing yoga. It really doesn't matter. Balasana or child's pose is a very good pose for opening up the muscles around the knees, for stretching the hamstrings, for opening up the fascia on the back line of the body. It's very good for the back body's myofascial release. It's good for focusing your attention inwards, giving yourself a little moment in the day just to focus on yourself, to regain your breathing, if you've had a stressful time, to regain some calm to your mind and your body. Without further ado, let's do child pose together. Let's discuss this. So child pose in a yoga class would normally be something that you would come to after you'd been doing a little bit of harder work, if you want to call it that. Sometimes when I've been in a yoga class, the teacher has instructed us to come to child's pose from downward dog, Adho Mukha Svanasana. So normally from downward dog, if you were in downward dog, let's go to downward dog. So if you were in this pose, downward dog, and you were getting tired, the teacher would say to you to come to all fours and take child's pose. So normally that would look like this. You would bring your knees almost as wide as the mat, you would bring your toes together, and then you would just slide back however you can manage it. Put your bottom onto your heels and you would relax down onto the floor. And in this pose, you would sink into the pose. However, there's one or two things that we need to take note of when we're in child's pose. For example, if you have a small problem with your knees, sometimes it's difficult to get your bottom onto your heels. And if this is the case, you could perhaps use something like this, like a rolled up blanket. You or your teacher or somebody nearby could help you just to put that there. And you could bring your knees and your heels together with a little bit of support in between them. And that would mean that you weren't worrying during the pose, I'm not touching my heels, I'm not touching my heels. So you could use that. And if still you feel that when you're going down into the pose, let me show you, I'll widen my knees and I'm using the blanket to allow my buttocks and my heels to have some sort of contact with something. But then sometimes, if the person's going down like that, this has made them a little bit higher, so it's almost more difficult sometimes for some people to get their head down to the floor without stretching their neck or straining their neck or feeling that their shoulders are coming up to their ears, which is something that we wouldn't encourage. So if that's the case for you as well, again, you could use some blocks to bring your head to, and then you're bringing the floor up to you. So you would, in this case, if you wanted it to be supported like this, you would have your knees as wide as your mat, you would have your toes touching and your heels slightly apart also as well with the line of your leg. You've got support under your bottom, between your bottom and your heels, and that's comfortable. You're on a nice neutral seat here. You would then just take yourself forward so that your forehead was resting on the support that you provided for yourself. So you could put that down like that, and you could stretch your hands just till you release your body onto the mat. You could keep them like this, but make sure when you're down that there's a bit of space between your ears and your shoulders. Don't hunch your shoulders up like this. Nice and long neck, long straight spine, and then you bring your head down and you can relax your arms either into a diamond shape, give some space between your shoulders and your ears, and then you just relax down into the pose and allow yourself to blend down into the floor. Let the floor take your weight and take some really nice, deep, cleansing, relaxing breaths in this position. So, as we gently come up, sometimes for people who are elderly or maybe somebody who feels that they've just not got enough energy to hold them up like that, you can use other things to support the core of your body, the middle of your body, so that you've got something to hold your whole body if you wish. A great thing for that would be something like this, or it could just be some cushions from your sofa wrapped up in a blanket piled on top of each other, and you could put that like this, and then in between your knees there you could just go down onto your support and turn your head to either side, hands just resting at your side, and this is the perfect relaxation pose to get into. And always remember, even sometimes in yoga, when a pose looks, when you're looking at other people doing it, you think it looks relaxing, but there's always some intricacies that maybe for your body or somebody else's body, it wouldn't be ideal. So don't think that if you need these supports or you feel that you want to use them, that's an issue, that it means that you're, less capable than someone else. It's not the case. Everybody is different. Everybody's body is different. And even the same body, the same person on a day-to-day level has different needs. So whatever you're feeling on that day, whatever pose in yoga you take, every day it could be different for you. Some days you might be able to do it just free-flowing and with no supports at all. Other days you might think, actually I've got a bit of discomfort here or a bit of pain here, and I need to use these other things so that I can use this pose, let my body utilise it fully and properly. So these are ways that you can do it when you're coming onto the floor. However, for some people, they don't want to go down to the floor for whatever reason. That's up to them. Perhaps they've been ill, or perhaps maybe if you've just had a baby or something like that and you just want to lie forward a little bit but relax, but maybe your tummy is sensitive, maybe you've got a caesarean section scar or something like that you're trying to be sensitive to. If that's the case, you can always do Balasana sitting in a chair. You can do Balasana sitting in your chair, where you just sit on your chair and lean forward onto your table, and that's good enough. And when you're leaning forward onto your table, if you feel that you've got any problem in the lower tummy here that's a bit sensitive, you can just put something in between on your knee, and then you put your head to your hands and just lie forward like this. onto your table, a bit like they used to make us do in the olden days in school. Anyway, that's Balasana, child's pose. It's a great pose. You don't need to be a yoga practitioner to do child's pose. It's a very good one for relaxing. If you've had a stressful day, you can come down to the floor. You can do some of the things that I've just showed you. You can do it with props or without props. If you wish, you can do it even with your knees closed so that you're coming down like this. You hinge from the hips and then you're coming down like this. Although that is hard for some people, they find that the knees are blocking them and the thighs are blocking them. So then they would just take the knees open, toes together, and they would come down in between their knees. I hope that's been useful for everybody, and remember the contraindications for this pose, very important. If you have damage to your knees, a knee replacement. If you have damage to your ankles, and ladies, expectant mums in their 3rd trimester of pregnancy, it's not the pose for you. So just be careful, practice your yoga safely, everything in yoga slowly and with consideration and mindfulness. And thank you for listening to me. Thank you for doing child's pose with me, and I'll see you next time. Namaste.